In these days, darkened by the suicides of 4 Canadian Forces members, a stark observation from those who work with veterans. They say that for every suicide in the military, there are several attempts. The government and the military say there are services in place, but tonight there are concerns about how accessible they are and whether soldiers feel confident and supported enough to ask for help. The CBC's Catherine Cullen begins our coverage tonight. Catherine.
Peter, the recent deaths have jolted several national mental health organizations. They say this is a public health issue, not just an issue for the military.
And this year is Ativan. I take
Christian Wolowidnik's time fighting in Afghanistan left him with post-traumatic stress disorder, anxiety, and depression. But it was being forced to leave the military because of his mental state that pushed him to try to kill himself.
That kind of just set me to the bottom.
He says news of 4 apparent military suicides in less than 2 weeks surprised him at first, but he knew he couldn't be alone.
Myself trying to take my life. If I've tried and failed, there's obviously other people who are thinking about it.
The most recent death on Monday, Sylvain Lelièvre from Canadian Forces Base Valcartier.
We is prepared for that. Even when we go to war, we try not to think about it.
At CFB Petawawa, it was Warrant Officer Michael McNeil who died. Master Corporal William Elliott died near CFB Shiloh in Manitoba. Master Bombardier Travis Halmras died in Lethbridge, Alberta. Earlier this year, the Canadian Forces reported suicide by its members was not on the rise, based on data collected since the mid-1990s. The same report said the rate of suicides by soldiers is lower than in the general population. This expert on mental health and the military says the reasons behind these most recent deaths are likely complex.
There are so many different factors that can attribute to someone taking his or her own life that to try to say this is what did it is challenging, if not impossible.
He says convincing soldiers to seek help is a problem too. Marc Dauphin agrees. He worked as a military doctor in Afghanistan. 4 months after he returned, he attempted suicide.
It's a very humbling experience for a soldier, and it's an even more humbling experience for an ER doc. We're supposed to be tough as nails and hard as rock, and yet there it was.
Those mental health organizations, Peter, say they plan to issue a joint statement tomorrow saying that the whole community needs to address this problem.
Catherine Cullen in Montreal. Thanks, Catherine.